The flu this season is coming in like a lion. This is a map of the flu activity across the U.S. So purple means high levels of activity. You can see several states are in the purple, including North Carolina, South Carolina, and Georgia. So here in South Carolina, there have been 9 flu deaths in the last week, 16 total this season, and 5 deaths here in the Upstate. If you compare that to last flu season, we've had 11 deaths related to the flu. So this season is surpassing that, and it's just getting started. So that's why we're here with family doctor Bijoor to join us from Oakview Medical Associates in Greenville. Thank you so much for being here.
Thank you for having me.
So let's go over, just what you've seen in your practice. I know doctors across the Upstate, across South Carolina, even the country, as we've seen, have seen more people coming in for the flu. What have you noticed at your practice?
So we have seen a lot of cases. Most of our patients coming in will say, it just hit me like a ton of bricks. I was fine, and all of a sudden I came down with severe body ache and fatigue, sometimes high fever, and just a lot of cases I would say in the last 2 weeks, even more this week.
And there's a new variant that's going around,
that's right.
Subclade K. What can you tell us about that?
So it's a variant of influenza A. Fortunately, the vaccine that has been given seems to be covering some of these strains pretty well, but it's just a mutant variant. So I think time will tell how serious our cases, how effective the vaccine is.
Because it's my understanding, so the vaccine covers H3N2.
That's correct.
And then subclade K is a variant of that, a mutation. So the vaccine is set to cover this, but this mutation, we think it will offer some protection, but we're not sure how much.
Right, because I think the mutations can occur at any point in time, and if the vaccine batch was made right before that mutation took place, its offshoot main variant would still be, hopefully covered in the strains that the vaccine was made from. So.
Okay. Now let's go over the symptoms of the flu. So what are those symptoms if you start to notice something, and how's that different from a cold?
It's very different from a cold. A cold typically starts with just runny nose and sometimes a sore throat. This hallmark of the flu, I would say, high fever, chills, body ache, severe fatigue, feeling like something has just hit you and just caused extreme fatigue. Sometimes a headache, and some of our younger and older population will have some atypical symptoms, sometimes some nausea, diarrhea, vomiting. So, I think those are the hallmark symptoms to look for. Headaches can also occur.
Now, do you think one of the reasons we're seeing more hospitalizations, more death this season is because of this flu variant?
I feel, yes, some of them, the cases could be because of, this new variant that is circulating. Also, I feel like people should get it tested the minute they suspect symptoms or have symptoms develop, because we can test you. If we clinically feel it is that, we can actually treat you. So early treatment is the key. Maybe some of these patients, I'm not sure, but maybe they just don't seek care as quickly as, they could have. So it's tending to get anybody and everybody. So I think time will tell. We have this flu watch, and the data will show us exactly the kind of what the factors are that are causing the severe cases, like the hospitalizations.
Because looking at the numbers, the vast majority of patients getting this are older, 50 and above.
Yes, yes.
So what are the treatment options if you get the flu, and how quickly should you contact your doctor?
You should contact your physician very quickly. I think if you have symptoms, you know your body the best. Just don't wait around for it to get better on its own. Get tested, get checked out by your physician, get tested early, because if you take the antiviral medication within 24 to 48 hours, it's very effective in reducing the duration of symptoms, reducing complications, reducing hospitalizations. And we have very effective treatments now. We have a 5-day treatment, and we have a 1-day single dose treatment as well.
So you don't have to just ride it out. You can actually do something about it. I think that's what a lot of us do. We just try to toughen it out. We think, oh, I'm fine. I'll call my doctor after a few days. But that's too late, right?
Yes, and it's like I said, it's not the common cold. That's something you can ride out. But when you have high fever, fatigue, body ache, chills, shivers and chills. That's one of the most common thing going around right now is influenza. So getting tested, getting treated early, resting, letting your body, recover from that is really paramount to recovering from this. We really focus on healing and recovery because there is no cure for influenza. The medications, they stop the replication of the virus. So they reduce the duration of symptoms. They help your immune system just recover from that.
Thank you so much for joining us. I hope it doesn't get too much worse, but I know,
Yeah, and it's not too late to get the vaccine too. That's a very important point.
All right. Thank you, Dr. Bijoor.
You're welcome.